If you're over 60, there's a good chance you felt this before. You eat a meal that's exactly the same as you did 10 or 20 years ago. Same dish, same recipe, same portion. But afterward, your body reacts very differently. Your stomach feels heavier. Your body slows down. Sometimes you feel a little tired, a little sleepy, or just not as clear and comfortable as you used to. And then a very quiet question pops into your mind. A question that worries a lot of people. Am I no longer able to eat the foods I've always loved? I hear this from many people over 60 in my clinic. They're not saying it because they're afraid of disease. They're saying it because they're afraid of losing something familiar, something that's been part of their life for decades. For many people, red meat isn't just food. It's family meals, it's holidays, Memorial Days, reunions. It's memories from a time when the body felt strong, capable, and able to eat anything without a second thought. And then the body changes, quietly, without warning, but just enough for you to realize you're not the same as before. Let me say this clearly right from the start. Your body's not betraying you. It's simply asking you to treat it differently. After 60, digestion slows down. The heart becomes more sensitive. Your ability to handle heavy fats, dense protein, and low-grade inflammation is no longer what it was when you were younger. That doesn't mean you need to fear food, and it doesn't mean you have to give up the foods you love. What you need is understanding, to know what's really happening inside your body so you can eat more wisely, not suffer by eating less. My name is Dr. David Warren. I'm 60 years old. I've worked with older adults for decades, and if there's one thing I've learned, it's this. Aging does not take away your quality of life. Lack of understanding does. In this video, we're going to slow things down together and take a closer look at what actually happens in your body when you eat red meat after 60, when red meat supports your health, and when it becomes a burden, and how you can still enjoy your meals while keeping your body light, your heart strong, and your energy intact over time. We're not going to talk about extreme restriction. We're going to talk about the biological wisdom of life after 60. Point 1. After 60, red meat isn't toxic, but your body processes it more slowly and with much more effort. Once you pass 60, 3 important biological changes start happening at the same time. Your stomach produces less acid, which slows the breakdown of heavy protein. Your intestinal movement slows down, so food stays in your system longer. Your liver and kidneys work more slowly, making fat and waste harder to process. Red meat is very nutrient-dense, but it also requires a lot of work from the body. When you're younger, your digestive system is like a powerful engine, fast, efficient, and resilient. After 60, that engine still works. It just doesn't run at high speed anymore. So the same piece of meat creates very different demands. Before Arrow, your body handled it smoothly. Now Arrow, multiple systems have to work harder at the same time. This is not a disease, it's normal aging physiology. When people understand this, many things suddenly make sense. That heavy feeling after meals isn't because your stomach is weak. Feeling tired after eating meat doesn't mean the food doesn't suit you. Feeling sleepy or sluggish isn't because you're lazy. It's because your body is using a large amount of energy just to digest the meal. When digestion consumes too much energy, your muscles temporarily feel weaker, your brain feels slower, your heart and blood vessels carry extra strain. Understanding this helps you stop blaming yourself and start adjusting your habits intelligently. You don't need to quit red meat. You just need to change how you eat it. Here are 3 important principles. Principle 1, reduce portion size, not nutritional value. After 60, a healthy portion is about the size of your palm. You don't need to feel full from meat, just enough to nourish your muscles. Principle 2, don't eat red meat when your body's already exhausted. Avoid it when you're recovering from illness, you haven't slept well, you've been under prolonged stress. In those moments, your body doesn't have the energy to handle heavy foods. Principle 3, eat red meat during the day. Lunch is the best time. Avoid late dinners. At night, your body wants to repair, not digest. I often tell my patients over 60, red meat doesn't make you weak. Eating it at the wrong time drains your energy. Start paying attention to your body. After a meal, do you feel lighter or heavier? Do you still have energy, or do you just want to sit still? Your body always tells the truth. The real question is whether we're willing to listen. Point 4. Red meat, silent inflammation, and why joint pain, stiffness, and fatigue slowly increase over the years. After the age of 60, the body enters a very specific state that medicine calls chronic low-grade inflammation. It doesn't flare up dramatically like an infection. It's quiet, but it lasts a long time. At the same time, several things happen. The body becomes less effective at shutting down inflammatory reactions. Tissues like joints, muscles, and blood vessels recover more slowly. Small stresses, when repeated over time, slowly build into bigger problems. Red meat, especially when it is high in fat cooked at very high temperatures, eaten frequently, can increase inflammatory signals inside the body. It's not that one meal causes joint pain right away. It's eating the wrong way for a long period of time. Once people understand this, many familiar patterns start to make sense. On days with a heavy meat-based meal, joints feel stiffer the next morning. The body feels heavier, dull, achy, harder to move when first getting out of bed. Some people notice knees that crackle or feel noisy, fingers that are hard to bend in the morning, ongoing soreness in the shoulders or lower back. Many people think this must just be old age, but the truth is, food can either increase inflammation or calm it down. Principle 1. Avoid inflammatory combinations: red meat plus fried foods, red meat plus late-night meals, red meat plus very little vegetables plus little water. These combinations hit the joints and blood vessels the hardest. Principle 2. Pair red meat with calming foods. When eating red meat, include dark leafy greens, vegetables with natural softness or moisture, gentle spices like ginger, turmeric, or onion. These help reduce the body's inflammatory response. Principle 3. Give your body inflammation-free days. Alternate days with no red meat, lighter, easier to digest foods. The body needs recovery time, especially the joints and connective tissues. I often tell patients with joint pain, pain is not the enemy. It's a message. If you notice, more joint pain after eating morning stiffness, long-lasting fatigue even when you sleep enough. Look at what you eat regularly. Not just ask, what disease do I have? Small dietary changes can reduce pain, improve flexibility, make daily movement easier. Point 5. Red meat, muscle, and how to eat to stay strong without losing muscle or independence. After 60, the body enters a very quiet process called age-related muscle loss. The important thing to understand is this: it happens even if you stay active, when nutrition and muscle use signals are not sufficient. There are 3 main reasons protein absorption becomes less efficient. Muscles need protein delivered in the right way to be activated. Heavy protein that is poorly digested cannot be fully used. Red meat is a high-quality protein source. But after 60, the issue is no longer how much you eat. It's how well your body can actually use that protein to maintain muscle. Eating a lot of meat while feeling heavy, feeling tired, moving very little, means that protein doesn't go into muscle. It becomes a metabolic burden instead. When you eat the right way, the changes are very noticeable. Standing up from a chair becomes easier. Walking causes less leg fatigue. Hands feel steadier when holding objects. The body feels more solid, more stable, less fearful of falling. Muscle is not just about strength. It's about the ability to care for yourself, confidence, independence. For people over 60, every pound of muscle you keep is extra time with better quality of life. Principle 1. Spread protein intake. Don't load all the meat into one large meal. Keep portions moderate, but eat at the right time. Eat when the body is alert. Principle 2. Eat red meat close to movement, before or after. Walking, housework, light exercise. This signals the body to use protein to repair and build muscle. Principle 3. Don't eat red meat on completely sedentary days. If you barely move all day, reduce portions, choose lighter foods. This prevents protein from being wasted. Principle 4. Pair protein with gentle movement. You don't need heavy workouts. Just Sitting down and standing up, walking around the house, stretching and loosening joints. The body needs a use signal, not high intensity. I often tell patients over 60, you don't need the muscles of your 30s. You just need enough muscle to live freely. Don't eat to compensate for weakness. Eat to stand steadily, walk safely, avoid dependence. The body is very intelligent. When you eat right, move right, and rest right, it preserves strength far longer than you expect. Point 6. How much red meat is enough after 60 without harming the heart, digestion, or increasing inflammation? The body after 60 doesn't need less nutrition, it needs the right dose. For most people, the problem isn't eating red meat. It's eating it too often, eating portions that are too large, eating it several days in a row. After 60, fat processing slows. Digestive recovery takes longer. Inflammation accumulates more easily. When red meat appears too frequently, the body doesn't have time to clean up after each heavy meal. The body needs space between heavy meals. When eaten in the right amount, many people notice positive changes. Energy remains after meals. Sleep becomes deeper. Mornings feel lighter. Joints feel less stiff. Mental clarity improves. The key point is, you don't feel like you're restricting yourself. You simply feel better. Principle 1, reasonable frequency. For most people over 60, 1 to 2 meals per week is enough. Avoid eating red meat daily, eating it on consecutive days. Principle 2, clear portion size. Each meal, about the size of your palm, not filling the plate. Remember, the rest of the meal should be vegetables, soup, and lighter foods. Principle 3, quality over quantity. Choose fresh meat. Lean cuts, avoid processed meats. Heavily salted meat, burnt or charred meat. Principle 4, cooking method matters. A lot better options. Boiling, stewing slow, cooking limit, frying, heavy pan searing. High flame grilling. I often tell patients, your body doesn't need to feel full to be nourished. It needs consistency and the right amount. If after a meal you still want to stand up, still want to move, can continue normal activities then, that meal is serving you. If not, it's not your fault. It's a signal to adjust the dose. If you remember just one thing from this video, let it be this. After 60, health is not maintained through extremes. It's maintained through understanding. Red meat is not something you need to avoid forever, but it's also no longer something you can eat without thinking, like when you were younger. Your body now digests more slowly, has a more sensitive cardiovascular system, accumulates inflammation more easily, and needs more respect from you. When you eat the right portion at the right time with the right frequency, and listen to how your body feels afterward, food stops being a burden and becomes real nourishment. Remember this, aging does not mean giving up joy. Aging means learning to live lighter, wiser, and more sustainably. If today you choose to, eat a little more slowly, leave a small piece of meat, add an extra serving of vegetables, walk for 10 more minutes, you are doing something very meaningful for your future. A gentle doctor's reminder. After each meal, ask yourself, do I feel lighter or heavier? The body doesn't lie. It always shows you the right path if you're willing to listen. If this video helps you understand your body better, please subscribe and walk this journey with me. Calm, science-based, practical conversations for people over 50 and 60. Disclaimer. This video is for educational purposes only and does not replace personalized medical advice.